On Thursdays, we bring in our health and medical news reporter.
Megan Gannon joins us now.
Thank you, ladies. Yes, flu season has officially started, and hospitals and health officials have seen an increase in influenza-type illnesses this past week. Although Florida Health Department doesn't test for the actual flu, rather flu-like symptoms, most pediatricians have a rapid flu test they administer and are positive some patients have already gotten the flu.
So we are seeing more flu, some that are testing positive. The emergency room seeing more. There have been reported a couple of hospitalizations in town, and we are seeing a little bit in our offices too.
The Florida Department of Health says despite the early rush of symptoms, the overall track of the season is still in the normal range. Officially, influenza in Alachua County is still classified as mild, with no deaths reported so far. The UF Health Shands Trauma Center celebrated its 10th anniversary today. This morning, the Trauma Center was recognized for its achievements in research, education, and service. The center offers immediate pre-hospital care, expert surgeons, and specialized rehab therapy. In the past 10 years, more than 24,000 trauma patients have been treated at this center with injuries ranging from severe burns to gunshot wounds.
So today we had a chance to pause and celebrate, look back on 10 years of greatness, look back at how every step of the way we raised the bar on patient care.
In the past 9 months, UF Health Shands Trauma Center has treated more than 600 devastating injuries. A story of CDC fieldwork on Ebola readiness comes from Anniston, Alabama. CDC staff members are teaching doctors, nurses, and other health practitioners how to handle patients infected with the deadly disease. The CDC plans to hold the free training sessions about every week throughout next January. The International Society for Infectious Diseases is providing grants to help healthcare workers pay for travel expenses to attend the training sessions. A dentist from the University of Louisville's School of Dentistry is warning about dental x-rays. Janelle McDonald explains the campaign to moderate radiation exposure for smaller patients.
I like taking pictures of anything.
In Sierra Ulrich's hands, a phone becomes just as good as any camera.
Sometimes it's more of outside things.
And sometimes she points the camera to herself.
I've tried to take pictures of my own mouth, and it don't work out.
Which is what brought her and her grandmother to U of L School of Dentistry for x-rays with just the right amount of radiation for a young body.
They're up to 3 to 5 times as sensitive as myself to radiation.
Dr. William Scarf is helping lead an awareness campaign asking dentists to consider just how much radiation their young patients are getting.
Is it necessary? Is always the first question.
Dr. Scarf says switching from film to digital radiology reduces the dose, as does focusing on a specific region instead of the whole head.
We should reduce the dose to what their size is, and that's called child sizing exposure.
Parents, he says, should look for a dentist to use a thyroid collar.
And that significantly reduces dose to children whose thyroids are very sensitive by about 50%.
All eye-opening information to Sierra's grandmother.
And I wish I would have known about that for my kids so that I could ask my dentist to make sure that he did not over-radiate them.
Now that she knows, the next pictures taken of Sierra's mouth, she says, will be done the right way.
And I can tell my son so that and my daughter so that they can make sure when they go to the dentist that they ask about that.
And as you may know, that's why that we do not get dental x-rays every single time we go to the dentist office.
Thank you, Megan.
Thank you, Megan.